My name is Aasim Padela. I am an assistant professor at the University of Chicago in the Department of Medicine, but I am also the director of the Initiative on Islamic Medicine at the university, where we conduct research on American Muslim health. Prior to coming to the University of Chicago, I spent 3 years at the University of Michigan, where we did community-based research looking at the healthcare challenges of Muslim men and women. Most prominent amongst women was this idea of cancer. There were a lot of cancer beliefs that they had. They were concerned about getting cancer screening. They didn't know how to take care of themselves when they had cancer. So that led me to move my research towards looking particularly at Muslim women's cancer screening behaviors and what sorts of beliefs led to them getting screening, and also what sorts of beliefs led them to not get screening. In this most recent study, we looked at what the religion-related factors were that impeded screening behaviors, particularly Pap smear testing amongst women. We found that women who interpreted life problems as punishment from God, so they saw whatever happened to them as a sort of retribution for things they had done, that these sorts of women were less likely to get cancer screening, in this case Pap testing. So for example, the entire sample, we found that 83% of the women had had a Pap smear once in their life, but there was a 15% less likelihood or lower odds of women getting Pap smear testing once in their life if they were women who interpreted life events as punishment from God. The main thrust of my research is to try to figure out what's similar amongst many different types of Muslim populations. So I have a hypothesis that because Muslims share their faith, there are some things that they do that are similar, even though they might be racially different, ethnically different, or from different backgrounds. So women might have just come and be immigrants, or women who were born here and reside in the United States for a long time. Because they all have this sense of Muslim identity, they might have similar patterning of healthcare practices and behaviors. This I had found in Michigan, and here in Chicago, looking at cancer screening, we found the same sort of behavioral pattern. That women from mosques, or women who are participating in community events or social life events, women who are from South Asian background or Arab background, or might even be from indigenous African American background, they have similar patterns of behavior. So in this particular study, we found no difference in screening behavior across race and ethnicity. We did find that women who had been here longer, so longer than 20 years, were more likely to get a Pap test. But aside from that, there weren't any other social demographic predictors of who would get cancer screening. One of the take-home messages with respect to medical education that this study and many other studies in minority communities is that we need to be attentive to women's concerns, right? In this case, we have to be able to elicit ideas that they have around coping or their relationship with God that may or may not play a role in their screening behaviors. Sometimes we're very worried about other things, right? So do they have a doctor? Do they have access to care? Can they get here for a test, as opposed to getting a sense of, well, what are you thinking about? What are your beliefs and barriers? Is there a way I can make you feel more comfortable? Next step is to take these series of studies around cancer screening behavior, first disseminate them like we are here in publications and as well as on online media and within the community. So empower the community to understand what's going on in their own community, in the mosques, what are women thinking? And then use that momentum to create an intervention. Women felt disempowered to talk about their health in the mosque setting. Now, that's particularly important if their ideas about God or their religion is now factoring into how they think about screening. We need to make that an open space. We need to have a culture of health within the Muslim community, and I hope to do that in these next series of studies.